Alhamdulillah, we're into our day 3 in Kutupalong Camp 1 Rohingya. Our plan today is to visit the clinic and work in the clinic. We will also talk to our nurses, midwife and doctors and understand and get a summary of the actual antenatal clinic, how it is run daily. So if you follow me, you will see currently the mothers who have just come in for clinical treatment into the actual clinic itself. I'd say about maybe 50 mothers with their children here. Already the clinic is heaving basically, so we're already overstretched. So these mothers will soon be basically seeing the initial nurses first and then going to the actual doctor, continuing to donate towards this vital antenatal clinical service, because without this clinical service we basically cannot service or help the mothers that are in there today, that are going to be getting clinical service from our nurses, from our doctors. And just to give you one indication, the doctor that we have here, she's a permanent doctor. She costs us the actual clinic 1 lakh taka a month. That's 12 lakh taka a year. That's her salary. So just to maintain that doctor is permanent and she's based here solely for the provision of care, we have to pay her 12 lakh basically a year. So you can see the actual cost of running a service like this. But this service is extremely important for the mothers of this particular area.
Mothers, sisters, young sisters going into puberty, they need this support. This clinic is helping those sisters and mothers that need that support. It's not just a medical support. It is a medical camp, but it's not a medical support. This is dignity. This is the dignity of our mothers and sisters. I've my mother and I've got 2 younger sisters. I can't imagine them having to go through something like this.
Assalamu alaikum warahmatullahi wabarakatuh, brothers and sisters. We're here talking to the main medical staff who actually run this clinic. I'd like to start by maybe asking Dr. Rafiq a few questions. Assalamu alaikum, Dr. Rafiq. Thank you for taking time here to talk to us. So just explain to me how many staff there are in this clinic at the moment.
I'm doctor here. I have joined here as a medical officer. Okay, then I have 1 nurse and 1 midwife here working with me. And the staff are night guard and others are not mandatory for medical staff. I have only those people here with me.
And do you think at the moment, given the number of people, number of women that are coming to this clinic, is that enough? Do you have enough staff here that can cope with the...
No, actually, daily from 10 to 3 p.m. I see patients around 20 to 25, maximum 30. Among these, we have 2 to 5 delivery patients daily. We have, at the same time, we have antenatal patients, postnatal patients. Then we need another doctor, 2 or 3, then nurses and midwives. So we need more manpower actually.
Absolutely. So just explain to me in your own words a day-to-day operation of when a patient comes in. Just explain to them, to us, for the donors, what happens exactly.
When antenatal patients come, like first trimester or second trimester, we just follow up them, give medicines. When in third trimester, at the end of the last stage, when a delivery patient comes, we first of all we follow up the patients. We routine check the patients. We work only on our clinical eye. We don't have investigation centers or nothing. We don't have all this. During delivery, we need a delivery labor table. We don't have this. We have only a bed. It's not sufficient. It's not sufficient. Then we need some stand for our saline set. Then if the patient is okay, then we keep the patient here for 2 to 3 hours, then we discharge the patient. If the patient is critical, like sometimes the mother's conscience is going critical or sometimes the baby is critical, we need to immediate hospitalize the patient. but we don't have any ambulance here. If the patient is, the condition is critical, we need to call the ambulance. We wait for them, for the ambulance. The ambulance will come. We will shift the patient. It takes more than 1 to 2 hours. The patient may be expired. It's up to God. So we need ambulance. It's a very emergency for us. Immediate after delivery, we normally give all the babies for 2 to 3 minutes or maximum 10 minutes oxygen. It's necessary. Maximum baby gets cyanosed after delivery or asphyxia, something like that. So we need an oxygen cylinder also.
So explain also to me how essential and how important are your medical staff to this whole process.
Yeah, it's very important. Like I'm here to deliver. I'm delivering a baby. At the same time, I need instruments. I need other things. I have other patients. At the same time, I need a helping hand to supply me the instruments, to manage the baby, which is very important. Immediate after delivery, I have to manage the mother. I have to manage at a time the baby. It's very important. That's why I need a nurse or midwife to manage the baby.
Could you kindly tell us on a daily basis how many patients do you get to register in this particular clinic?
For regular checkup or?
Yes, for all kind of medication.
Oh, around 50, 60.
Okay, all right.
Generally, when an antenatal patients come, we supply them iron, calcium. Then, when a general lady come, like she's not pregnant, we can't tell her that you go or something like that. They come like with fever or like diarrhea or like abdominal pain or epigastric pain like this. Then we have medicines, but it's not enough actually. All the medications, it's not enough. We actually require more and more medicines to supply the people.
Just wanted to ask you, doctor, you mentioned earlier about an ambulance.
Yes.
If a patient that you see and she is in critical condition, at the moment, what happens? Take me through what happens to a patient if they're in critical condition, what happens?
The most critical conditions we usually face is like that after delivery, the mother starts to bleed. Okay? Not always, some maximum time we found that kind of patient. When this condition happens, we have to call an ambulance, which is not available here. We don't have. Then we call the ambulance, and ambulance will come. It takes, I told earlier that it takes more than 1.5 hour to 2 hours. If we have ambulance emergency for 24 hours, we can immediately shift the patient to the hospital, like within half an hour or within 20 minutes.
So we can see that an ambulance is
very
essential. What I wanted to basically ask you is a little bit of a personal question. Do you and your staff enjoy your work in this clinic, basically?
Yeah. First of all, I'd like to thank the Co-Foundation that they gave me opportunity to work with you. It's all about like Rohingya people. They are first of all they are homeless. They are away from their country. So I feel honored actually.
And if, for example, say tomorrow, the funding for this clinic stopped suddenly, and we could not keep this clinic open, how much of a major loss will not having this clinic be in this area?
Okay.
Can you explain that?
This clinic is mainly based for the pregnant ladies. Okay. So in the meantime, it had started from February 2018. In the meantime, all of them know about that. In this clinic, only the delivery patient comes and for antenatal checkup and postnatal checkup, any kind of problems. Doctors are here. We provide any kind of problems. We help them. If it suddenly stops, I think, where will they go? Where will go? Where will the delivered patients? I have seen many patients before. Where will they go?
So if you had 30 seconds and you could ask anyone in the UK, the donors, what would you say to them? And just explaining very, in a few words.
Okay. First of all, I need some manpower. Like I need some my colleagues like midwife and doctors. Minimum 2 or 3 doctors is very necessary here. Then nurses are also important. Like we have only 2 nurses and 1 midwife. It's not enough. We need more nurses and midwives. And please do provide an ambulance for us.
Having an antenatal clinic and having more than 20,000 pregnant women, you have seen and witnessed and consulted a lot of patients from now till the 6 months time. What would you say about how many pregnancy you can imagine having their baby delivered from this clinic?
I think 100 to 150, maybe within next 6 months. I have seen patients, maximum I told you earlier that maximum are in mid-trimester. So we can hope that in the meantime 3 to 4 months we can have delivery like 100 to 150.
Just to reiterate, and what you heard from the medical staff here, we still have shortage of equipment this is not from us, this is from the medical staff that have basically said, there is a shortage of doctors, there is a shortage of nurses, there are a shortage of midwives here.
Instruments and equipment.
And equipment as well. We desperately need an ambulance. If we could have an ambulance here, the time to send a patient to hospital can be cut down significantly, and that could make the difference between that particular patient staying alive effectively. At the moment, as you've heard, a patient, we would have to call an ambulance. It would take them an hour, hour and a half for that ambulance to come along and then transport the patient to the nearest hospital, which is about 15-20 minutes away. So not even far. If we had an ambulance, it would make a big difference. If we could do with a delivery labor table as well. If we had that here, it would make life very important. Brothers and sisters, the first struggle for us was to open this clinic in this area. We thought it wasn't going to be possible, but Allah made it possible. And Alhamdulillah, since that time, because of your donation, hundreds of babies were born in this clinic, in the hands of these doctors and these medical staff. So brothers and sisters, your Sadaqah Jariyah is ongoing. Please help us to protect this clinic by continuing with your donation, because if we do not continue with the donation, then this clinic may have to be stopped, because it's difficult. Even the monthly bill in this particular clinic goes up to about really 4-5 lakh, basically 4.5 lakh currently, basically, and we're already overrun. The medicine bill alone is 1 lakh a month effectively. So you can see the amount of investment that we need to run a clinic like this. And inshallah, Allah willing, if we can ask for your donation, and donation is forthcoming, we want to do different things with this particular clinic. But at the moment, it's just about securing what we have by getting more medical staff, by getting more equipment like an ambulance, like a delivery labor table, like a stand. Without those things, it's very difficult for us to service this particular local community who are in desperate need of an antenatal clinic like this. Jazakallahu khair. Assalamu alaikum.